Okay, good morning. Aloha, welcome to the Hawaii State Capitol. My name is John Mizuno. I'm the Vice Chair of the Health Committee. And sitting to the left of me is State Representative Joe Bertram from Maui. He's also on the Health Committee. We're conducting an informational briefing to review the current state and federal laws as they relate to medical marijuana or cannabis. We'll be specifically looking at such areas as possession, transportation, secured growing facilities, and we'll even be looking at some of the conflicts with state and federal law. We're also going to be reviewing other state laws and how they compare with Hawaii's law. We're also going to discuss House Bill 2675, which was passed by the 2008 legislature, but vetoed by the governor. I should add that this great piece of legislation was actually created by Representative Joe Bertram. So he actually shepherded this bill through the legislative process. And we're not here to fight with the administration. We're here to work with the administration, so we just wanted to bring that out. And at this time, I'm going to turn it over to Representative Bertram. He's going to give you a little more background about the bill and some of his concerns about some of the conflicts with the law. And after that, we're going to go into our agencies. Representative Bertram.
Thank you. Yes, so basically, first of all, I wanted to kind of briefly go over the reason why we had the 2675 as we were trying to address the problems with our medical marijuana law as it stands now. And just from this point on, I'm going to be saying medical cannabis law because that's a very important point to make, that we no longer use the slang term for cannabis, which was used very effectively to criminalize and make it something that was very dangerous and unusual. So I'm really on a real mission to see us move it to medical cannabis from this point forward. And one of the things in trying to address these laws were a couple of reports that came out. One was the American College of Physicians report, which came out just this year, 2008. And I have an overview of it here. Basically, it talked about, it was released this year. It's called Supporting Research into the Therapeutic Role of Marijuana, even though we're calling it cannabis now. And their position was very clear. They had 5 main points they wanted to make, which talked about that there is so much information and research, and even in their initial thing, saying that there's thousands of years of actual experience with this medicine already, besides the fact that now there is a wealth of scientific evidence that also backs this up. They had 5 main points, mainly relating to to allowing for a better atmosphere to actually do more research onto it. But the last one was the most cogent to what we were trying to accomplish, which was that the American College of Physicians, which is the second largest after the AMA, supported it, urges protection from criminal and civil penalties for patients who use medical cannabis as permitted under state law. Now, this is something that they strongly support, as well as for doctors. And from all our experience with patient advocates, we have found that that is not the case in Hawaii, that our state law is so vague and is not clear on how to get this medicine for themselves, that we've experienced quite a lot of law enforcement against legitimate users of medical marijuana. So that was the intent behind this bill, to try to create a better distribution system, a system that actually allowed for people to be able to get this medicine, recognizing, I think it's even in this report, the extreme difficulty in developing and growing medical grade cannabis. It is not something you can put in your backyard and just expect that you're going to get this in an adequate supply every 2 or 3 months, or whatever the cycle of these plants are. This is something that is basically a science, and it's something that is not possible when you're sick, or if you're living in areas that just do not allow for this type of growing to go on. And so it's really important that we find ways that sick people can get the medicine that they have been allowed to by the state.